Good morning, ladies and gentlemen. I'm Manika, Scientific Program Coordinator with Flora Fauna Science Foundation. And on behalf of the Foundation, I welcome you all to the very interesting session of Flora Fauna Talks on the season's theme, Krishi Se Khushi. After celebrating National Nutrition Week, which is held every year from September 1st to September 7th, to raise awareness about the importance of nutrition for the human health, our topic for today becomes even more pertinent since it focuses on healthy aging. Joining us today, we have Dr. Sharad Kasarle, an expert in medicinal nutrition and functional food, as our lead speaker. It is an honor and privilege to have you here with us, sir. Welcome to the forum.
Thank you. Thank you.
We also have Professor S.P.S. Khanuja, Founder Chairman of Flora Fauna Science Foundation, Dr. A.K. Singh, Senior Vice President of the body, and Dr. Neeraj Jain, General Secretary of the Foundation. Greetings and welcome to all. May I now request Professor S.P.S. Khanuja to please initiate the session as well as welcome our guests. Over to you, sir, for opening remarks.
Thank you, Manika. Welcome, Sharad, Dr. Kasarle, as people know him. I also welcome all the participants of this very important session on the platform that Flora Fauna Science Foundation provides. As Manika told that we are moving on the theme of this year, Krishi Se Khushi, where we are talking of agriculture giving us the opportunities in various forms, including foods, entrepreneurship, agribusiness, and also entrepreneurship through post-harvest technologies. Just to make everyone aware, Flora Fauna Science Foundation works on annual themes. And when we started it 3 years back, we had Khet Se Sehat as our theme. And last year we had Poshan Se Roshan as the theme. And this year it is Krishi Se Khushi. And next year we would be making once our next innovation summit in February comes. I must say that we are very fortunate to have Dr. Sharad here today with us, who is a stalwart in terms of the knowledge that he has, and also his passion for nutrition, which he has been pursuing with all communities at no cost to them. And we brought him to this platform to spread it, what he wants to do all over India through our various wings. Dr. Sharad is a man who knows as much of Ayurvedic or traditional knowledge as much the modern science of pharmaceutical sciences or nutraceutical sciences goes. And therefore, when we were discussing that what title it should be, I suggested to him if he could speak on a very special topic, that is healthy aging. Particularly, we are concerned about the seniors of the society who have a decline in their metabolism when they attain a particular age. And because of that, the way they should take nutrition becomes different. So although this session today is going to be focused on those who want to have a happy aging, aging in such a way that it doesn't bring out any disorders or ailments that usually people are afraid of through nutrition. That means the preventive way of living well. It also would give us that, since this is going to be a concept of Nutri Thali for seniors, the thali or the diet in which we can have various components that will help seniors to live a very healthy life. It will also give agriculture a boost in the sense that since this is plant-based Nutri Thali, therefore all those plants which Dr. Sharad is going to tell you, the farmers have opportunities to make those as their crops and processes, and then their next generation making that through post-harvest technology into products which can reach this thali. So that would, in a way, bring us to not only Krishi se Khushi for farmers, but Krishi se Khushi for elders also. So it becomes very, very important also from the point that Sharad knows very well that when we interact on scientific platforms in seminars, symposia, and other places, there are some people who are very senior and very knowledgeable, but they do ask us that what for us? What do you have for us? And at that time, if we are not ready with an answer, then it becomes sort of, that we are half knowledgeable. And particularly, it becomes also important that they have as much protein requirement or rather more protein requirement than at a age before they cross 60. But then digestibility of the protein, bioavailability of the protein becomes an issue, and what should be the right source so that they don't get uneasy even during the day when they take sufficient amount of protein. So those type of parameters, and also since lifestyle diseases start taking a severe form at aging population, and therefore how do we really manage it rather than suffer from it, would be the thing that we are going to learn from Dr. Sharad today. So I would say that Dr. Sharad, who has been doing a wonderful work, going to communities in parks and in schools and in various platforms, and enlightening them about how they should live happily. He also gives consulting advice to people who want to know about nutrition or preventive healthcare. That being a part of, I'm also happy to say that Dr. Sharad is a very important part of Flora Fauna Science Foundation. And therefore, now, although we started it, but it did not take shape, I would suggest that if Dr. Sharad is going to make a Mumbai chapter of Flora Fauna Science Foundation and disseminate the knowledge as much as he can, we will discuss those modalities later after this talk. So I'll not take more time because I'm standing between knowledge and those who want to seek knowledge. I would request Dr. Neeraj Jain, our General Secretary, to introduce formally Dr. Sharad so that those who are meeting him for the first time know more about it. Dr. Neeraj.
Thank you very much, sir. And good morning, Dr. Kasarle. So for the viewers here, Dr. Sharad Kasarle, a man with passion for serving the society and nation, is a food scientist and technologist from UDCT, Mumbai, working in the area of medical nutrition and medicinal herbs. He is Chief Scientific Officer at Vega Nutritech LLP and Chief Executive Officer at DSK Nutrition Research Center. Prior to his current role, he worked with Alchem Laboratories Limited as Vice President and Head Nutraceuticals, National Food Industries Limited, Jeddah, Marico Industries Limited, and Corn Products Limited, which is NOR. He is functional food expert and practitioner in natural medicines or medical nutrition. He is on board as expert at various medical conference committees to medical professionals. He has an experience of over 3 decades of R&D, regulatory and medical marketing, expertise for chronic clinical conditions such as neurodegenerative disorders, including Alzheimer's, Parkinson's, stroke, and dementia, cardiovascular support in form of nutraceuticals to help enhance circulation and maintaining healthy lipid profile. He also has an expertise in nutrition for diabetics and obesity, for bones, joints, and muscles, and for prevention of diabetic retinopathy, muscular degeneration, and glaucoma. He is a distinguished speaker at various national and international conferences and also on electronic media channels. He has offered consulting services in R&D, regulatory, medical marketing to reputed Indian pharma like Dr. Reddy's Laboratories, IPCA Laboratories, Intas Pharmaceuticals, Wallace Pharmaceuticals, to name just a few. With this brief introduction, I hand it over to you, sir.
Sir, you may please unmute yourself.
Is the screen is clear?
So visible. You may.
Visible? Yeah.
Yes, thank you.
Thank you, Flora Fauna Science Foundation. And it's an honor to speak maybe on plant-based nutrition. This is my 76th episode in various conferences and seminars. Most of the people, when we talk about nutrition, we say omega-3, coenzyme Q10, collagen, all these type of supplements for neurodegeneration or cardiovascular ailments like chronic heart failure. So people ask, are there any sources of plant sources for coenzyme Q10 or collagen and this type of life-saving medical nutrition? Many of them surprised to know Arjuna tree, that is Arjuna bark, has the highest concentration of coenzyme Q10. So you need not worry about the animal-based coenzyme Q10. So Arjuna bark, which is normally the medicine prepared as Arjuna rishtam, which is my research super specialty as well. This has a lot of cardiac as well as lungs boosters. Now during COVID pandemic, we have seen depletion of oxygen, also poor lungs capacity, lungs fibrosis, brain hypoxia or hypoxemia, that is brain is receiving lesser oxygen due to various types of infections, that was COVID coronavirus, or maybe some other secondary infection, can be bacterial or fungus. That's what we saw in mucormycosis and all that. So I'm a hardcore research person. I never went into any other type of specialty like manufacturing or other type of things, specialized in R&D and also medical marketing, because in order to dictate the terms of this nutrition or explain the nutrition to the medical field so that they can take it as a prescription, even though preventive. But nowadays, there are a lot of nutraceuticals which are under therapeutic. We all know vitamin D at higher level. We all know iron. We all know calcium. We all know omega-3, which has entered into prescription. There are a lot of nutraceuticals which have entered now. Coenzyme Q10 is the highest prescribed nutraceutical for congestive heart failure, myocardial infarction, and cardiac complications, which can risk our brain with the hemorrhagic strokes and various types of disabilities. Now, going forward to plant-based nutrition. Next slide. Yeah. Now, Khushi se Khushi, here this is taken from Atharva Veda. Basically in Veda, right from my age 6, I started reading Veda. And I am proud to say that for each and every medicinal plant is associated with Ayurveda. For example, Shatavari has the Shatavari, that is Shatam is 100 and Vari is blessings. So there is a mantra in Atharva Veda or Ayurveda. Basically, Ayurveda is derived from Veda. Shatamanam bhavati, Shatayu, Purusha Shatendriye, Ayush Shevendriye Pratidishtati. Shatendriye, that means we all 100 organs and we all want to live 100 years. Shatayu, Shatendriye, Ayush Shevendriye Pratidishtati. Now here I want to highlight, you can live without gold, you can live without manikya or diamonds or any other luxuries, but you have to depend for food on farmers. Without food, you cannot survive. That is what this beautiful mantra from Atharva Veda, which is starting our session of today. Suvarna Raupya Manikya Vasanai Rapi Puritaha तथापि प्रार्थयन्तेव कृषकान भक्त तृष्णया. आपकी जो तृष्णा है, आपकी जो भूख है, your soul gets satisfied with the food. Soul doesn't get satisfied with maybe ornaments. You become greedy. है हमारे पास धन तो मुझे और चाहिए. लेकिन अन्न ऐसा है. Anna is Parabrahma. Why Anna is Parabrahma? Once your stomach is or Trishna is satisfied, you feel happy, and that is why Krishi say Khushi. Khushi is the real happiness, and that happiness is the property of soul and your mind. Mind is not defined in anatomy. In any of the anatomy, I normally teach the medical students also. the role of nutrition and how anatomy works for each and every nutrient. Of course, that is a very detailed topic, but to start with, Khushi se Khushi, we must thank our farmers and we must make them consolidate with the, or strengthen them with the more and more knowledge and technology, so that what they produce will be dictating the health of the entire nation. Now here the banana leaf is shown, which we have forgotten. Almost today, we are now banana leaf has got lot of antioxidants like epigallocatechin gallate. Now, banana leaf, serving food on banana leaf has got spiritual value. And also because of these antioxidants, it helps maintain the healthy blood glucose levels and cholesterol levels in case of hyperglycemia and as well as hyperlipidemia patients, high cholesterol patients. So the food gets better digested when you use banana leaf. Also, this type of leaves of the plants, what is blessed by our mother nature, can be used as a food packaging. I have seen some posts on Flora Fauna Science Foundation, similarly, that some food packages instead of using polythene or using some foils and all that, whether we can encourage usage of these leaves like banana leaf can be utilized, so that we really say food is the medicine. Now here, to more focus on food is the medicine, I would like to say, when food becomes the medicine, or you understand the nutrient value of what you are eating in your Nutri Thali, food is the medicine. So housewife becomes the physician for the family, because your kitchen becomes the clinic then. Your kitchen is like a clinic, and then we can proudly say prevention is better than cure. So housewife prepares the food with love, compassion, care for the entire family. She knows the ingredients, what she is using in the kitchen, and that is what is my awareness program. Everyone knows what is ginger, what is garlic, what is moringa, what is pumpkin, what is papaya, everything. But very few know the medicinal benefits derived out of these foods is the real mission, which I feel that kitchen can make, you can make the healthy clinic. There were few medical conferences, even TV shows with Professor Ramamurthy, who is a leading physician. Then C.B. Purandare is a leading gynecologist of India. Dr. Boraskar, who is the head of diabetology in SL Raheja, and Professor Dr. Pehlajani, who is the cholesterol and intervention cardiologist, where the common topic was that the management of your diabetes, management of obesity, management of cholesterol and triglycerides, management of heart disease and cancers is not in any clinic, but in your own kitchen. So prevention is better than cure, and there are a range of nutritional ingredients which can benefit or prevent the complications, further complications of these life-threatening medical conditions. We'll go through all that. Now, of course, this is a statistics which I can share the presentation. This is as per WHO, leading causes of death, and it is of course the ischemic heart disease or cardiac arrests. And we are seeing that the incidences of clotting, incidences of stroke and sudden cardiac deaths have increased since pandemic. And there are a lot of reports getting published that post-pandemic effects on your cardiovascular, on your renal health, as well as your brain health. So this is a real matter of concern. So nutrition becomes all the more important factor to live happily and to tackle various types of inflammations and infections. Everyone knew during pandemic how oxygen is critical. Now there is a debate whether oxygen is a nutrient or oxygen is just a necessity, but the debate is now coming towards that, yes, oxygen is a critical nutrient. So when we talk about nutrition, we must talk about oxygen. And in 1931, Dr. Otto Warburg, who won the 2 Nobel Prizes, saying that every cell which has cancer that is deprived of oxygen and pH is too low, that is acidic pH. So range of medical conditions like elevation levels of CRP. Now we know C-reactive protein is a liver inflammation, and that can lead to even cancers, arthritis, heart disease, and sudden heart attacks. So CRP is a major inflammatory biomarker, which is now become the medical a must do the test. Now, lungs fibrosis or COPD, the deaths are more and more doctors have suffered with this lungs fibrosis and COPD during COVID pandemic. Breathing difficulties. Now, those already had asthma or anemia, for example, low hemoglobin levels. For them, this particular presentation would be a life-saving presentation. Now, we would be talking about whether we can get oxygen from the food also. Some people are not able to breathe properly. So how can we replenish their blood oxygen carrying capacity or lungs capacity? And that can boost your heart function as well as your brain function. So even cancers and tumors are also associated with depletion of oxygen and too much of acidity. These are the two factors majorly defined in a lot of medical journals, that the reason of cancer can be plenty, but the main reasons are depletion of oxygen in cellular level and hyperacidity. That is the key factor. 65% of our food should be towards alkaline. Now, this is a list of all the foods as per the pH. Now, alkaline pH is above 7. 7 is a neutral. So you drink water, that hydration is a key. Minimum 2 liters of water is a rich source of oxygen. So hydration is becoming more and more important factor. Other than the patients who are suffering from kidney disease or chronic kidney disease, they need to restrict water. So otherwise, water is excellent source for detoxification, removal of all the toxins, not only from blood, but also from liver, pancreas, lungs, and everywhere. So staying hydrated is more important, neutral, and 65% of our food should be more than 7 pH. And there are the examples which I have given on the right hand side. Lemon, even though they taste acidic, but internally they make it alkaline. Coconut water, occasionally, because those who are on compromised this renal diet, for example, where potassium levels are high, they need to restrict. So there was my post on coconut is good for whom and coconut is bad for whom. So coconut can also lower your hypotension, that is blood pressure. So those who are already having blood pressure problems, hypotension, that is blood pressure having 90/60, lower than that, for them coconut water is not recommended. But for hypertension, hypertensives, coconut water becomes the boon. Lemon juice, and third important is the buttermilk, the beautiful source of riboflavin, and it is a liver detoxifier. Many few people know, many people like the beautiful taste of buttermilk. After the food, we normally take buttermilk so that the food is digested in a better way. So adding coriander leaves, ginger, or even pudina or mint leaves to the buttermilk can make your digestion and better gut-brain connectivity. That is another topic, gut-brain connection. And these are the superfoods like buttermilk or curd or yogurt. These are the superfoods which improve our gut-brain connectivity. Now, of course, these are various recipes which can be suggested as a Nutri India or Nutri Thali, like ragi dosa is there. Then you have pearl millet, dhokla or jawar ki bhakri. Curd rice is important. Moringa sambar rich with moringa. And of course, there are a lot of other items which can make from ragi or various types of millets. Coming to the very basic thing, fruits. Nowadays, people eat less fruits, which is a main responsible factor for IBS, constipation, hyperacidity, and lot of acid reflux problems. Now, fruits, some people have a lot of myths. Fruits are very sweet, so not recommended for diabetics and all that. So there are myths which I will be covering on the last slide. The myths need to be attended by scientists like us. And because social media is full of myths, social media is full of spreading wrong information. So this is a very important slide, especially because fruits are not only sweeter. It's not that they're only sweet and they can make your blood sugar levels worse, but fruits are rich in enzymes, soluble fibers, prebiotics, antioxidants, vitamins, minerals, nucleotides. And remember, diabetic ketoacidosis. What happens in ketoacidosis? Instant renal failure or instant organ failure. Ketoacidosis because when your cells are deprived of glucose, they start eating your fats from the body, and the person loses the fat mass and also the muscle mass. He becomes lesser in weight. You can suddenly see the weight loss of 10 kilos or 15 kilos in a short period of time. That is basically ketoacidosis. And ketoacidosis is very common in juvenile, that is type 1 diabetes and few gestational diabetes. But now type 2 diabetics with uncontrolled diabetes, they are also suffering from ketoacidosis, which makes instant renal failure. And kidney problems are very difficult to manage today. Other than dialysis and end-stage renal disease is almost a kidney transplantation. So fruit diet is very important, having various sources of antioxidants and natural nutrients, basically. The word nutrition, I believe that it is actually the natural nutrition the one has to take care and one has to look for. That is why I normally take my various sessions, making awareness of which fruits and which vegetables are rich of what nutrients, basically. This is very important. Now, in the topic of nutrition, the supplements which are promoted, which are having artificial colors, artificial flavors, preservatives, and all that, I can never trust them as a natural nutrition. They are not, and in fact, there are very wrong labeling saying that these are natural nutritions. So capsules, tablets, your colors, flavors, artificial sweeteners, this can never be the natural nutrients. Natural nutrient is beautiful color of our mother nature. You can see the slide. Of course, this is taken from the Google, but you see the natural fruits and vegetables colors which are there. They are antioxidants, carotenoids. They have got lycopene, lutein, zeaxanthin. They are basically rejuvenator of eyes. In fact, cataract operation, after cataract surgery, I am also consulting to a lot of ophthalmologists. In case of diabetes, there is always a danger of diabetic retinopathy. There was one seminar on retinopathy and sudden blindness. And the topic of the seminar was, is blindness more scary than heart attacks and stroke? Yes, blindness is more scary. Suddenly you become blind because of retinopathy. After post-cataract surgery, people find that suddenly their intraocular pressure, that is eye pressure, is elevated, and suddenly they went into glaucoma and blindness as well. Retinopathy, there's a retina damage, is also seen after the post-cataract surgery in elderly. After 60 years of age, people notice that suddenly they get blurred vision, or the vision is totally like red. Everything, vision like a red everywhere. So that is basically leakage of blood vessels in microcapillaries of retina. And there are certain nutrients to prevent this retinopathy and also to reduce intraocular pressure to prevent glaucoma-induced blindness. These are the super specialty topics which can be introduced as a part of medical nutrition. We see tomato and heart. This is just a comparison of our mother nature with the medical properties. Like lycopene is not only important for heart health, but also prostate enlargement or prostate-specific antigen. Those who have got elevated levels of prostate-specific antigen, that is a biomarker for prostate cancer, tomato becomes very important. Tomatoes are also important for your vision as well as brain function. Now, pomegranate we see, and the red blood cells. Those who are anemic or having lower hemoglobin levels, of course, there will be a depletion of oxygen in such type of patients. Low hemoglobin is always dangerous. Their lungs capacity will be compromised. Also, their heart and brain capacity will be compromised. So pomegranate and red blood cells, they look so identical. And this is a nature's communication that pomegranate resembles red blood cells. The word goes BP. Now, Dr. Suman Khanuja rightly said, I do the scientific dissection of the short forms. Like BP is blood pressure. So I say B for beetroot and P for pomegranate. So the best medicine for hypertension is BP, beetroot and pomegranate, the juice which you can take. But make sure that you are not hypotensive. Those who are having low blood pressure, cannot take beet because beet root, there are a lot of published medical journals. They say that beetroot lowers your blood pressure units by almost 20 to 30. So those who are having hypotension, they cannot take BP. BP is only for hypertension and those who are having high blood pressure. Avla and curry leaves, that drink which have, this is a complete detox basically. The center one is alcohol substitute. Now this is very interesting topic. Many people say that when you advise people to leave alcohol, they change the doctor. They say that this doctor is advising change, so change not changing the alcohol, but they will change the doctor only. So this detox drink, which is alcohol substitute, and listen the recipe of it. It has got apple and Mosambi pulp. Apple and Mosambi pulp. In that, apple cider vinegar, just to give a tinge of fermented taste. Apple cider vinegar 10 to 15 ml, which is anti-inflammatory, good for diabetic patients, and also those who are suffering from hypercholesterol. Mostly the alcohol drinkers, they are suffering from hyperlipidemia, as well as some heart elements, and also the liver problems. So apple cider vinegar. Then mint leaves. Mint leaves gives the beautiful flavor to this. Put ice cubes, because normally the alcohol drinkers, they like to drink with ice. You can put soda also as an exemption. Soda you can put. And see the taste of it. This can beat any alcohol or any wine. This has a wonderful taste. And then I advise you can keep some peanuts and papads and all those things and make a ghazal atmosphere. Put a light ghazal, and then in the dim lights, you try to drink this rejuvenator drink. This will eliminate all your minus effects of alcohol, because apple has got pectin and quercetin. Apple cider vinegar is well known as anti-inflammatory, and also it also prevents liver going into cirrhosis from fatty liver. So that is another one. Mosambi is a rich source of various nutrients. So with the peel, you can put the Mosambi inside. Pudina mint will take care of proper digestion, absorption, and also it will take care of your acidity, hyperacidity, and other things. Normally, alcohol drinkers, they face acidity problems. So this pudina not only adds to the flavor and taste and boost the taste of your apple and Mosambi, it also gives you relief from hyperacidity. The chilled drink always gives you relief from hyperacidity and also acid reflux. So this is a kind of substitute which many people tried, and they commented on my personal WhatsApp. They said, "Doctor, this is amazing, and we are ready to switch over from alcohol to such type of natural alternatives. So why not we work on more and more to make such type of concepts as more viable and easy to follow in your own home, in your home kitchen." Now, of course, these are the pulses. We know that various compositions are given here. Pulses, and as always I do, pulses balance our pulse. So whatever heart rate or pulse, you require your pulses. So pulses, they are balanced with proteins, fats, fibers, minerals like calcium, iron, zinc. So variety is the essence of life. You can have variety of pulses which are available. And next slide gives you the protein content. So why you have to depend on artificial proteins or concentrates and isolates, which diabetics have difficulty in digestion? I suggest to the council that we should make compulsory to declare renal potential load of proteins, that is RPL. What is the load of proteins on your renal function? Most of the people, they suffer from lower EGFR, glomerular filtration rate, higher creatinine level. As aging progresses, your creatinine level becomes more and more, and also your EGFR, that is the glomerular filtration rate, drops. So digestibility of proteins becomes a major issue. So now we say that PDCAS value, that is protein digestibility corrected amino acid score, but more important are branch chain amino acids, leucine, isoleucine, valine, which are wonderful source found in your buttermilk itself. So there are natural alternatives instead of going for isolates or concentrates and other form. And how much has to be taken? How much is too much? That is also needed, because nowadays people consume thinking that more you consume, more will be your better will be your muscle mass and all that. But remember, your serum creatinine. Creatine is one of the amino acid which is dangerously put inside the protein formulations, which increase your serum creatinine level. So always watchful on your renal function test, which is blood urea nitrogen, as well as serum creatinine, eGFR, that is glomerular filtration rate, and also uric acid. Most of the people, they're having arthritis or goiter and painful rheumatoid arthritis, they are the initial what you can say, the problem area is elevated levels of uric acid. So these are very important things. So you get a lot of proteins from your regular beans and pulses and dals, and substantial quantity, that is almost in 100 grams, 35 grams, 36 grams in soya bean, you can see. Then lupin beans, then velvet beans, red lentils, all these have excellent between 20 to 30 to 40 grams of protein. So these particular chickpeas have 13 grams of protein per 100 gram. So I think pulses need to be the important part as protein. And another one is vegan, low glycemic, gluten free. Now gluten is another area which I would like to focus on, talk on, because a lot of people say don't eat wheat, don't eat rice, don't drink milk. So then what the poor people will eat and drink? So that is another topic. I think 5 minutes we'll spend on that. Pulses are good source of proteins, fibers, and that's what we have seen. The slide gives the authentic information taken from the USDA and RDA informations. This is another chart which gives you complete insight of beans and legumes, which are high in protein and the nutritive values. Now, the incidences of Alzheimer's. Now, Alzheimer, you will all be surprised to know that it is known as type 3 diabetes. Type 1 is juvenile, type 2 is insulin dependent, juvenile is insulin dependent, and type 3 is now Alzheimer's, that is brain also secretes insulin. 80% of people with Alzheimer's have insulin resistance or type 2 diabetes. So this is a statistics given. So normally any diabetic or chronic diabetic patient who's in spite of increasing your anti-diabetic medications like metformin, glimepiride, and various other anti-diabetics, even insulin, they have difficulty in maintaining their healthy blood glucose levels. The important factor is, and the nutrition focuses mainly on glycemic index and glycemic load. But the more important factor is insulin index. That is number one. Fasting insulin level, HbA1c, serum electrolytes, because the deficiency, mainly the diabetic patients, they face is deficiency, that is DM is normally we call diabetes mellitus. So DM, the deficiency of vitamin D, and M stands for magnesium. Most of the anti-diabetics, they deplete in B12 and magnesium. They make us low in B12 and magnesium. That is how neuropathy, that is peripheral neuropathy in diabetes, becoming more and more chronic, and people live in a lot of pain. Even venous insufficiency like varicose veins, and because of the poor blood circulation in diabetics, that is another problem that people are facing, that is varicose veins and deep vein thrombosis. And most of the heart attacks are because of venous insufficiency. That is why diabetes induces more risk, first risk to your heart and vascular function. So the more important thing is to maintain your blood glucose levels with proper nutrition. That is why serum electrolytes is coming into highlight. Serum electrolytes gives you sodium potassium balance, as well as the mineral deficiencies like magnesium. Another one, the main cause of Alzheimer's, sudden memory loss, or chronic Alzheimer patients, they stop even eating foods. They don't know how to gulp the food also. So that Alzheimer's, those kind of Alzheimer patients, they keep on visiting me. One, the celebrities, they keep on visiting for certain suggestions. The number one thing what I tell them, that test your heavy metals. Test your heavy metals, your blood heavy metal levels, and most of them are found with heavy lead, arsenic, and mercury in their blood. So this is another area for food safety, that we must ensure that heavy metals like lead, arsenic, mercury, chromium, the levels, because they are very, very dangerous. They can do the organ damage, and these particular heavy metals, they are very difficult to eliminate from our system. And those who are already suffering from kidney disease or anemia or asthma or various types of liver function problems, they will have difficulty in eliminating this particular heavy metals and poisonous metals. Another one is allergens. Now, few people are allergens to certain things. So allergen test becomes very important in coming to the advice for the nutrition for chronic patients. So allergens, like somebody may be allergic to wheat, soya, gluten, dairy, all eggs, all these type of allergens, they need to be considered as well in order to suggest some healthy nutrition to any patient. Of course, this is continuation, and millets, of course, we say that it's a rich source of magnesium. When the magnesium, important of magnesium, as we discussed in diabetes, that unless your magnesium levels are maintained properly, your diabetes will not come under control. D stands for vitamin D, and 85% of our population, almost 80 to 85%, are vitamin D deficient. And another reason is vitamin D needs vitamin K27. There is one boast of mine, ek duje ke liye. One needs another one as a partner. Like for calcium absorption, you need vitamin D. For better vitamin D, you need vitamin K27. For vitamin K27, you need magnesium. And for better magnesium absorption, you need B12. And deficiency of B12 makes your red blood cells deficiency of your basically hemoglobin, platelets, and various crucial blood parameters. And that all depends on your cellular oxygen levels, and also acidity and reflux and all other things starts. So nutritional deficiency can link into. Now WHO also agrees that 90 to 95% of medical conditions are linked to nutritional deficiencies. So these nutritional deficiencies need to be properly diagnosed, properly treated. And there is, of course, the role of Veda and Ayurveda. Of course, that is another topic other than nutrition. Now, this is, I was talking about jawar, which is it's a jewelry of our mother nature, is jawar. So jawar is rich with all types of nutrients you will get, and those who are gluten intolerant, they can also take this jawar. So jawar bhakri, and with some curries or vegetables or moringa, this can be the beautiful Nutri Thali concept. Of course, there are foxtail millets, and there are various paisam or kheer, or you can do khichdi out of these millets, and this can be the also best food from the blood sugar stabilizing point of view. And you get magnesium and various other crucial minerals, which are very important for your pancreas and heart function. Of course, these are the various recipes which I had covered. Now, barley. We all know that barley is a kidney cleanser. Now, CKD preventive, that is those who are having second stage kidney disease. Now, where the glomerular filtration rate is less than 60, that is the second stage. When glomerular filtration rate, EGFR, is lesser than 40, that becomes third stage of kidney. And when glomerular filtration rate is lesser than 15, it becomes the fourth stage, that is CKD. And fifth stage is ESRD, that is end stage renal disease, where there is no other choice than replacing or the kidney transplantation is the only way out. Now, barley as a kidney cleanser, those who are suffering from kidney stones or that kind of thing, then it is a best cleanser with lemon juice. Barley works as a natural diuretic. Those who are having difficulty urinating, most of the kidney disease patients, they have difficulty in urinating. So this becomes the excellent natural diuretic, blood purifier, and they also controls your blood urea nitrogen. And there are reports that magnesium-rich barley water is recommended for flushing out your kidney stones. Those who are, and also gallbladder stones. Now, there is, when you are suffering from gallbladder stones, most of the patients, they have to compromise their gallbladder itself, because the surgery removes the gallbladder. So those who are having the minor gallbladder stones issues, certain things like MCT coconut oil, which I will talk about later, MCT coconut oil and barley lemon water, or any particular dish made out of barley, that can be a boost for your overall kidney function, takes care of your kidney stones, and also the calcification of kidneys, and also the creatinine and EGFR can be well maintained using such a superfood barley. Now, this is a nutritional composition which is given. It's a folic acid, iron, everything is there. So as far as your hemoglobin, red blood cells are concerned, barley can be a superfood. Magnesium, selenium, antioxidants, best for diabetic patients. Beta glucan, which is there in barley, is a antioxidant which is normally used for cholesterol lowering. So there are a lot of medical advantages which has given, and also the nutrient composition is given. So barley can be considered as a superfood for our future generation. Moringa, of course, we all know, rich of all the nutrients which are there in the Mother Earth, or all nutrients are there in this particular and the concentrated form. So moringa, and always I consider avla as 0 in mathematics. Avla, whenever combined with any vegetable, it increases its value. For example, avla with moringa is the best superfood for diabetic patients and those patients suffering from arthritis. Moringa is rich in calcium and vitamin D and various other, even B12. There are reports that vitamin B12 is there in moringa. So avla with moringa can be a super antioxidant or superfood for metabolic syndrome or those who are facing with diabetes and diabetic complications. Another one is avla with brahmi is another superfood. So any herb or any vegetable you combine, it increases or enhances or synergize its value. Avla with brahmi, muscle relaxant, brain relaxant, insomnia, those who are having insomnia, those who are having a poor neurotransmission like Alzheimer's and Parkinson, those who are on tremors, then brahmi with avla becomes the more important for Parkinson's kind of patients also. Brahmi with triphala. Sorry, avla with triphala. Our triphala, avla is already one of the constituent, but when you add avla to triphala in added quantities, it takes care of your constipation, IBS, and various other gut disorders. It strengthens your gut-brain axis, which is vagus nerve. Vagus nerve is the biggest nerve connecting gut to the brain. So avla is the main rejuvenator for your gut and brain. It improves your skin, eyes, heart health, all that is known. That is why avla is the currency. We say that there is a currency like we say gold and rupees and all that is a currency in heaven. And there is one stotra, Kanakadhara stotra. It is written by Adi Shankaracharya. Kanaka means Suvarna, that is gold. And when he praises Mahalakshmi, there was a rainfall of avla to a poor Brahmin's house. Rainfall of avla. That is called as Kanaka Dhara. Dhara means like a rainfall. The Kanaka is Sona. Whereas our avla becomes a Suvarna avla, the rainfall of avla at that poor farmer's house, where Adi Shankaracharya went for Bhiksha. So Kanaka means is gold. So that is why we say Arogyam Dhana Sampadam. Your main dhan is Arogya only. Your health is only wealth. There is no other wealth can satisfy you other than your health. So when it comes to that, moringa becomes the superfood, avla becomes the superfood. Now curd rice, always being a South Indian, this is my favorite, easy to digest and lot of nutrients, and you get full satisfaction. That is a satisfaction along with some pickle, maybe a mango pickle or a lemon pickle or chilies pickle. That can be the best food. So another point I would like to touch on, whether rice is not good for diabetics. So there are a lot of myths and misinformations which have been spread across, need to be corrected with respect to the nutritional benefits and how much is too much. When we say food is the medicine, eat food like a medicine. Don't overeat it. So that is what is the main concept. Moderation is the key. Everything has got a lot of nutrient values. Only thing you have to decide how much is too much. Now again, the dissection of the words cancer. Now there are a lot of conferences, even medical conferences I did. So cancers, the first 3 words say can. That is giving you the hopes to the patients. Number one, that the patient's counseling has to be perfect. They must get to understand that Mother Nature can heal everything. Only you have to trust and you have to keep trust and faith. In Ramayana, Ram kept the trust on Ayurveda, and that trust and the efforts of Hanuman, that has saved the life of Lakshmana. So trust comes the more important thing, and Mother Nature is serving thousands of years, And there are a lot of documentations. People say that there is a lack in documentation, and there would be some conferences going on, coming up with the documentations which are already mentioned in Veda, but we are not able to study, or we are not able to authenticate it, some type of things. So cancer, C stands for vitamin C. There were 2 Nobel Prizes won by Linus Pauling. Vitamin C cures cancer. And this was also explored by certain doctors in AIMS through the instructions of whatever instructions of mine that they can consider. Vitamin C IV reduces cancer antigens drastically. Curcumin turmeric extract is another cancer preventive, or in the treatment. The global cancer institutes like MD Anderson Cancer Institute, even Tata Memorial Cancer Institute, all these leading oncologists and oncosurgeons now started believing in curcumin and turmeric extract. Ceylon cinnamon is another one which not only reduces your blood sugar levels, blood pressure, and blood cholesterol, but very powerful antioxidant. Orac value of cinnamon is 265,000, which is another plus point, that Orac is nothing but oxygen radical absorbance capacity. They improve our lungs oxygen capacity, they improve our blood oxygen carrying capacity, and that is the main area or main way to reach the root cause of oxygen depletion and treating the cancer. Citrus fruits, of course, reach of C. A stands for Avla, Amruta, which is Guduchi, Ashwagandha, and antioxidants. Antioxidants, they lower oxidative stress. N of cancer is no non-veg. That is, normally the foods which are non-veg, like red meat, they increase CRP levels. Now we know CRP is inflammatory biomarker. So inflammation goes high. So that is why better to restrict non-veg, sugary foods, alcohol need to be restricted, and tobacco, of course, is big no. Another C stands for your carrots, coriander, celery, collagen. Now, there are vegetarian sources of collagen. You'll be all surprised to know that collagen is derived from nuts and seeds like almonds, then papaya seeds, sunflower seeds, pumpkin seeds. They are all rich, they are collagen precursors. Collagen is basically the animal nutrient, but the collagen can be also produced using the plants. Shatavari is blessed with a lot of collagen precursors. That means when you consume shatavari, you get a lot of strength and stamina and rejuvenation. It improves your sex power, everything. We all know that shatavari has blessed with a lot of, and also the hormonal imbalance. Mainly, shatavari is given for hormonal imbalance in cancer patients, so reducing inflammation and hormonal imbalances. That is, that collagen or shatavari becomes a very important. E here stands for exercise. We say omega-3 like EPA is also good nutrient. And emotional well-being, mostly the fear factor or panic factor in cancer patients. Emotional well-being. So emotional well-being is very important, and one has to think, one has to do the spiritual meditation, yoga, and all those practices helps a lot. R of cancer is resveratrol, or naturally the antioxidants which are derived from grapes. There is one antioxidant from pine bark, which is known as proanthocyanidins. We have plenty of pine trees in India. And pine bark, they are the super antioxidants. Basically, pine bark and coenzyme Q10 are now, there is a trend to combine, that is known as pycno-Q10. That combination of CoQ10 and pine bark, they rejuvenate your heart, they rejuvenate your liver, they rejuvenate your lungs, and rejuvenate your kidney. So CoQ10 with pine bark. So these are the antioxidants which are also anti-cancer. So that cancer dissection, now normally I say that dissection of your disease with respect to the nutrients. Like I said, blood pressure, BP is beetroot and with pomegranate. Similarly, I do PSA. PSA is nothing but prostate specific antigen. P stands for pomegranate, S stands for saw palmetto, and A stands for avla. You name any disease, there will be the nutritional solution. And that I have done for more than 1,500 medical conditions. So anybody wants this type of simple tips. Now next is, basically we see the Orac values. Now, of course, this is known to everybody, but may not be knowing. Clove over 3 lakhs, cinnamon, I said 2,67,000, oregano, turmeric has got 1,02,000, but curcumin has got over 15 lakh Orac value. The highest Orac value now is astaxanthin, which is promoted 28 lakhs Orac value. Then Triphala, 7 lakhs. So Triphala is rich source of antioxidants. So Triphala is not only for constipation. The people or most of the doctors, physicians, they say that you take Triphala for constipation. No, Triphala rejuvenates your eyes. Triphala means it balances your Vata, Pitta, Kapha. Triguna, Karam, Trinetram. Now, Trinetram is what we also say that your vision, that the third netra is your vision, your foresee. How you can see? Vision is what you see the world, but you see the beyond the world, and that is Triphala, that is the Trinetra. So Triphala has got balancing effect of Vata, Pitta, and Kapha. So Triphala has got antioxidant. In terms of modern science, modern technology, we have to explain in terms of Orac values and other things. Otherwise, Triphala has got 7 lakh Orac value, which is highest. Avla has got 2,65,000. I had all these Orac values of various fruits, vegetables, spices, herbs that they are giving. Why they are so medicinal? What is the reason of medicinal benefits that they are providing? So this is very important phenomena. Now ginger has got 28,000. Now we know that ginger has got anti-cancer. Not only they treat chemotherapy-induced side effects like nausea, vomiting, mouth sores, all those kind of things can be well taken care. Now ginger has entered into the prescription. Lot of antacids, or even you say domperidone medicine, or lot of pan-40. Now they are fortifying with ginger. They are fortifying ginger in anti-inflammatory medicines also, like your diclofenac, aceclofenac, paracetamol, and various other painkillers or non-steroidal anti-inflammatory painkillers. Their ginger is entering as anti-inflammatory. So the nutrition is very vast field. It penetrates throughout the medicine. Likewise, I said, it is like a Manusha. Manusha I define as M stands for modern medicine, A stands for Ayurveda, N stands for nutrition, U stands for Unani, S stands for Siddha, H stands for homeopath, Y stands for yoga, and that is why Manusha's last A is Ayushman Bharat, Swastha Bharat. Because we need to integrate all this type of medicine. Instead of blaming Ayurveda, instead of blaming modern medicine, instead of blaming homeopathy, instead of blaming this, we need to integrate. We need to combine all the expertise, scientific expertise, into one platform as a health mission, as a health platform. And where I feel nutrition plays a bigger role, our agriculture, our food plays the highest role in prevention as well as in treatment of these complex complications. Now, of course, the camu, this is also very rarely known. This has got 30 times more vitamin C than avla, 60 times more vitamin C than oranges. So this becomes the camu, which is like a Arjuna phal, Arjuna tree that has got fruits. But this is extremely sour, and this is rich in not only vitamin C and zinc. So there are benefits given of vitamin C and also the mineral zinc. We all seen during COVID, loss of smell, taste, and your sensory problems that are associated with zinc deficiency. So camu becomes the very advanced nutrition as far as treatment of cancer or treatment of any particular chronic inflammatory conditions like CRP. C stands for CRP, C stands for vitamin C. So these type of things can be corrected using camu, which I am also advising a lot of patients for camu. Curcumin, we all know, and the whole world is knowing it. But the main factor remains is curcumin. This is turmeric or curcuma longa, has got 517% RDA of iron. So for hemoglobin deficiency, most of the cancer patients, they struggle with hemoglobin, platelets, and WBC counts. So best is curcumin. Why curcumin is working for, but the bioabsorption of curcumin is very bad or very poor. Not even 1% is absorbed in your blood. So for better bioabsorption, what we do is the addition of turmeric as such, turmeric and curcumin, and with that ginger and pepper. These things are fortified, and where bioabsorption is enhanced to almost 90%. So blood curcumin level can be detected, and blood curcumin concentration is very important in order to receive all the benefits. So your hemoglobin deficiency or red blood cells, lower red blood cells, or even elevated levels of WBC. In cancer, what happens is instead of limit of 4,000 to 10,000, some patients like acute lymphocytic lymphoblastic leukemia, these patients, their WBC crosses even 1 lakh, even 2 lakhs and all that. So such type of nutrient, this is an extremely good blood purifier. Other than curcumin, we recommend neem also. Neem, tulsi, ginger, these are all blood purifiers. So, and fenugreek, of course. So these blood purifiers, they help WBC counts, which are elevated beyond levels, beyond the dangerous limits. They help the patients to come back to normal. So apart from improving hemoglobin, these patients have lower hemoglobin, lower platelets, and much elevated levels of WBC. These are the symptoms of chronic cancer or acute lymphocytic leukemia or blood cancer, what normally we all know as. Now, this is again the scientific dissection of CPR. We all know cardiopulmonary respiration. For heart patients, we give. So these nutritionally, we say C for curcumin, P for pomegranate, and R for resveratrol. So cardio, and also they have benefit like cardio, prostate, and renal. These three combinations are recommended for those who are having prostate enlargement, prostate dysfunction, or frequent urination kind of problem. So these particular CPR, these are nutritional CPR. The CPR, when you take it other way, it is CRP, that is C-reactive protein. So again, the dissection says for C-reactive protein, you have one thing only need to be added, that is cranberry. Now cranberry, curcumin, pomegranate, resveratrol, all these are beneficial for lowering CRP. But CRP levels above 6 are dangerous. Some people, they get CRP levels due to the infections, chronic infections or heart disease or even cancer. The CRP levels crosses 50 or even 100. So for them to come back to the normal, other than the medical advice, these type of nutritional advices helps a lot. And there are patients who have recovered from CRP level of even 75 to CRP level less than 3 in a span of 2 months. Now, of course, these are the benefits of resveratrol and pomegranate, what normally we see. MCT coconut oil. Now, this is gaining more importance, more and more patients of Alzheimer's, Parkinson's, as my expertise area of treatment. MCT coconut oil becomes very important functional nutrient. Now, it is also given to LBW, that is low birth weight infants. Those infants who are prone to chronic infections and also low birth weight. So MCT helps them, and it has got highest concentration of lauric acid. That is what should be taken. And also MCT derived from coconut oil. There is a specific word used, coconut, because there is also MCT derived from palm oil, which has got less significance and less number of clinical studies and medical benefits listed there. So it penetrates blood-brain barrier. That is how it improves your neurotransmission, memory, concentration, recall, learning abilities. Those who are having tremors or even epilepsy kind of seizures, they get benefited. And there are a lot of patients with which MCT coconut oil has been used, and they have seen the huge benefit. Even Parkinson's, tremors, and also the muscle movement gets better with medical nutrient like MCT coconut oil. MCT is also given in PCOD, PCOS, and irregular menstruation, irregular cycle, menstrual cycles. So MCT coconut oil becomes very important in maintaining hormonal balance. Those who are having hypothyroidism, TSH levels, they elevate above 4.5 or above 5. Sometimes they go way high. And then this particular MCT coconut oil, along with vitamin D and omega-3, excellent combination for healing hypothyroidism patients. Hyperthyroidism, TSH goes below. So even in that case, MCT coconut oil, hyperthyroidism sees a lot of benefits. Now, in hypothyroidism, patients experience weight gain. Hyperthyroidism, patients experience weight loss. So, and also there are a lot of mood changes, depression, anxiety, restlessness, all those kind of symptoms which are associated with the dysfunction of your thyroid hormone. So MCT comes first there, whether it is a brain health or your hormonal balance. So MCT coconut oil, right from the day 1 of your life, that is infant of day 1 till elderly population, MCT can be administered in food or it can be as a medicine. Now there are reports on fenugreek. this is scientific publication which we did, anti-cancer nutrient, garlic and fenugreek. Fenugreek kills 72% of breast cancer cells in lab study. Of course, this need to be studied further. Now, as we see, the cancer has become epidemic and the growth is enormous. There are a lot of reports coming, the cancer growth, even in Times of India, they are given 250% increase in number of patients, especially the breast cancer and metastatic cancers. So fenugreek becomes the major nutrient with respect to its the profile. And fenugreek not only helps diabetic patients, we all know fenugreek lowers your HbA1c, also maintains your healthy blood glucose levels. Fenugreek has a role in maintaining your healthy cholesterol levels. Now, cholesterol lowering, instead of that, I would like to say maintaining healthy cholesterol, because you need high level of HDL. HDL is a good cholesterol and LDL is a bad cholesterol. So lower amounts of bad cholesterol. So lower your bad cholesterol. Don't say lower your cholesterol. HDL. So most of the drugs which are focusing on cholesterol or triglycerides, they focus on even HDL gets dropped in that. Like antibiotics, they also kill probiotics. So more important thing is focus on your HDL. Most of the heart attacks, they are because of low levels of good cholesterol, HDL, and very high levels of serum triglycerides. So these factors are very important, and fenugreek keeps the beautiful balance of your cholesterol as well as that is LDL and HDL profile that is maintained properly. Also, your blood sugar is maintained properly, and this is also reported as anti-cancer. Now, 72% is quite substantial, though it is a small lab study, but need to be done on a fairly large subjects or patients. Now, PCOD, when I say the dissection, these are the few examples I have given in this particular because cannot be covered all the medical things. Now, gynecological problems, we all know P stands for papaya, pomegranate, pineapple. Pineapple has got bromelain enzyme that is anti-inflammatory. So most of the gynec problems like pelvic pain or endometriosis or menstrual related problem, menstrual cramps, they are better controlled by pineapple, which is now bromelain is a prescription product again. So bromelain is prescribed by a lot of orthopedicians for relief from your rheumatoid arthritis or cramps or that kind of thing. C for coconut, as I said, coconut MCT, curcumin and citrus fruits. O stands for omega-3 and PCOD. D stands for vitamin D3, vitamin A. D also stands for dahi. That is our curd. It's a probiotic which improves your gut-brain connectivity. And when you say PCOS, only replace D with S. S is Shatavari. Shatavari maintains hormonal balance beautifully. So that is the solution. And these particular things, these lectures have given in a lot of schools and colleges and even medical colleges. And this has been appreciated. This slide has been appreciated. Even papaya seeds. Now there are references that papaya seeds, they rejuvenate your liver function. Now we all know papaya looks like liver. The shape of papaya and shape of liver, identical. So it improves your liver function. It prevents fatty liver and also fatty liver entering into the dangerous liver cirrhosis. So papaya seeds have got a lot of significance as far as liver health is concerned. Of course, PCOD treatments with superfoods like nuts and seeds. This was published in Times of India. My own article was published in Times of India. And this type of seeds and nuts, they help maintaining your menstrual cycle, treating PCOD, PCOS kind of problems, and also hypothyroidism. This is what is given in a nutshell. Now, sweet potatoes and pancreas, they look similar. Also, another report which is coming, sweet potatoes beneficial for Parkinson's. This is well tested and tried. To some patients, I have given, other than MCT coconut oil and curcumin, I have recommended them to eat foods which are rich in carotenoids and fibers. Sweet potatoes are one of them, and sweet potatoes help for, and this is the wonderful composition of sweet potato. There should be a justification why sweet potatoes are beneficial, superfoods for brain. Now, brain consists of 60% fat. Out of 60%, 50% are omega-3 fats. That is why nuts and seeds and all these carotenoids, antioxidants like vitamins like A, D, E, K, these are the fat-soluble vitamins which are very crucial for brain function. And that is what is administered. Another useful tip for Parkinson's I give is the chewing exercise. Like carrots. You just chew it, because you cannot gulp carrot like rice or noodles or something like that. You can easily eat without chewing. Now the foods which need chewing, the chewing becomes the exercise for your neurons, and their neurotransmission becomes better, and they feel satisfaction. And that is very important, that this type of crunchy foods like carrots or radish, that is mula, this type of, even cabbage. So these type of things can be chewed, or can be chewed properly. Now avla, we all know that is a superfood, but there is a report protects liver from cirrhosis. This is a very wonderful report. Another one I wanted to highlight is red banana. Even peels of banana, even our normal banana and this type of banana, they are rich in dopamine, and the levels are as high as 500 milligram. No pharmaceutical tablet of L-Dopa will give you this high dosage, and this is a natural, which is 500 milligrams per 100 gram pulp or 100 gram, and these peels can be consumed. Now banana peel has got highest concentration. So there was one post that never throw peels of vegetables. What are the various nutritional benefits derived out of these peels of the vegetables, like banana vegetable, you see? Then another one is the pomegranate grain. That is a pomegranate peel. We make nice tea out of pomegranate. When you boil pomegranate skin with water, and you can make tea out of it with whatever ingredients you want to put it. So that is excellent rejuvenator. It has got a lot of nutrient value. So pomegranate peel, never throw pomegranate peel. That is number 2. Number 3 is basically there are certain vegetables like dudhi. Now dudhi skin, we make delicious chutneys. So most of the people, they remove the skin while making the vegetable. That is also good. There's a rich source of fiber and other magnesium and other things. But the peel has got lot of nutrients. You'll be amazed that will take at least 1 hour to describe what are those nutrients that will give you wonderful benefits. Even colorectal cancer, that is a so painful colorectal cancer, that is being healed by such certain types of peels of the vegetables. So this is another topic which you may consider in future, that how we can preserve our nature. Now, this is a nutrition for overall health, normally anti-inflammatory, infections, fight from infections, fever, high CRP, all those things. This is a drink out of lemon, tulsi, ginger, cinnamon. Simple ingredients, nothing special about it. But when you make a tea out of it, and you can add jaggery for taste, if you want sweet, you can add jaggery. So lemon, ginger, cinnamon, tulsi, these things are rejuvenators. They can do a lot of benefits to your respiratory function, respiratory tract infections, fever, even thyroid function, weight management, etc. Iron, folic acid, we all know that is very critical. Now these are the carotenoids, like elderly, as we grow, our eyesight or eye related problems, and nowadays most of the people are exposed to more screen time, more on laptops, more on Android phones, so their eyesight is always a problem. Other than that, medical conditions like diabetes and anemia and all those kind of things also make complications. So dementia, anxiety, depression, eye health, cellular aging, even cancer. Even there are eye cancers are growing, eye cancers which are difficult to treat. So these type of simple foods, like which are rich source of lutein, zeaxanthin, lycopene, astaxanthin, all those things can be beneficial. Green leafy vegetables like palak, which has got lutein, zeaxanthin, even iron, vitamin C, everything which are blessed by our mother nature can be considered into our day-to-day life. Cranberries is very important for urinary tract infection. This is being prescribed. Another superfood which has entered into the prescription route. So for urinary tract infection, frequent urination, urinary incontinence, bladder infections, overactive bladder. After urinating, you still feel that your bladder is full. So that kind of discomfort, nighttime urination, there is one unique fruit, which is cranberry, which is also available in extract form or any other as a nutraceutical remedies. Now, also other than that, it eliminates your calcium oxalate. So most of the oxalate stones. So cranberry acts as removal of calcium oxalate or kidney stones. That is another plus area to understand about your cranberry. So normally I say KYC. We all see in the banks, we do KYC. So KYC is nothing but know your client, not know your client, but know your cardio, know your cranberries. So this is another KYC which one has to regularly follow. Mother Nature is communicating so many things, but we need to list out, and also there is a lot of documentation and evidences available. May not be available in the scientific format or dossiers, what normally we do for pharma industry has introduced this dossier format. Otherwise, in Veda, the simple mantra, for example, the beautiful, we all know Vishnu Sahasranam. Only 2 or 3 examples I'll give so that to understand the relation of Veda and Ayurveda. To understand that, in Vishnu Sahasranam, there is a mention of Brahmi. Brahmavid Brahmano Brahmi, Brahmaknyo Brahmana Priya. That is Brahma who created the entire world or entire nature. He created Brahmi, and Brahmi is Buddhi Vardak. That is how the Brahman has come. The Brahman started introducing the knowledge to the world. That is the job of Brahmi, and all this knowledge of that is being produced by Veda. They enhance our Brahmagni. Brahmagni, what is Brahmagni? Is nothing but what we know is the gut fire. Brahmagni is Jataragni. Gut fire is very important. So food or anna acts as our gut fire. They enhance our gut fire, and that is how your digestion, metabolism, absorption, assimilation of ingredients, everything is coming into the scientific documentation. The basic is Brahmavid Brahmano Brahmi Brahmakni Brahmana Priya. So these Brahmagni or Jataragni or gut fire, and then we say gut is connected to brain, and so gut is unhealthy, then your brain is unhealthy. So all the diseases of neuro degeneration or neuropsychiatric, they originate from your gut. So if we believe all this, there is a Veda reference, and one has to provide that reference, and that reference I have studied for more than 10,000 medicinal plants. So this is incredible. Right from the age 8, I started studying about Veda, and that is how I have never studied Ayurveda in any college. I am not Ayurvedachari. I have not done any Ayurvedic course, but I have done the Veda. And without understanding Veda, Veda is the heart and soul of Ayurveda. Unless you know Veda, you cannot know Ayurveda. Another one is Bilva. We all know Bel Patra, Bel Phal. This is another, may not be significant for this particular session. But in Shri Suktam, like we have seen Vishnu Sahasranam, now is Shri Suktam, that is Lakshmi Stuti. Aditya Varane Tapasodi Jato, Vanaspatis Tava Brukshoksha Bilvaha. सब वनस्पति में सूर्य के समान कांति लाने वाली बिल्व पत्र के समान कोई औषधि वनस्पति नहीं है. आदित्य वर्णे, आदित्य मीन्स सूर्य भगवान. आदित्य वर्णे तपसोदि जातो वनस्पतिस्तव वृक्षोक्ष बिल्वः. Bilva has got trinetra, tridalam trigunaakaram trinetram cha triyayudham, trijanma papa samharam eka bilvam shivarpanam. Mulato brahma rupaya, madhyato vishnu rupine, agrata shiva rupaya, eka bilvam shivarpanam. So it has got Brahma, Vishnu and Mahesh. And the same thing, the food has been described. Annam Brahma, Raso Vishnuhu, Pakto Devo Maheshwara. That is the food which is produced by agriculture. Is Brahma. That is, Brahma is producing the Srishti. But when you take food for the cooking, the rasa is Vishnu. And when food is cooked and completely ready, it is ready for your ahuti of Jataragni, it is Mahesha. It is a Maheshwara. So it is a Tridalam Trigunakaram. There is a Trinetra. Three has got lot of significance. That is what Ayurveda say, three guna, three dosha. That is Vata, Pitta and Kapha. So all these three factors are very important in our life, which rejuvenates our entire body. Shatendriye. We say that we know only heart, brain, kidney, eyes and all that. There are Shata Indriye, that means 100 organs in our body. And in order to rejuvenate all these 100 organs, Shatendriye, we need to understand the food and the Mother Nature's natural remedies. Mother Nature is working so hard. Beautiful formulator. I know Dr. Suman Khanuja has said, wholesome is always awesome. That is what he had taught me. He is my guru. I treat him like my guru. I take a lot of lessons from him. Wholesome is always awesome. Why blame wheat? You blame wheat, then there are 500 products you cannot eat. You cannot eat bread, you cannot eat biscuits, you cannot eat noodles, you cannot eat pasta, you cannot eat pizza, you cannot eat burgers. Then don't blame only chapati or roti. Doctors say don't eat roti. Roti बंद कर दो. Roti बंद कर दो मत दो. उसके साथ list दो कि रोटी के साथ आपको क्या-क्या बंद करना है. This is all misleading information. Myths. What I feel. Wheat germ is a treatment for chronic inflammation and also cancers. Wheat bran, excellent source of fiber, which even diverticulosis, colitis, ulcerative colitis, it is a treatment. So don't blame the wheat. Wholesomeness of wheat is always awesome. And wheat intolerant or gluten intolerant people are less than 1%. The rest of them, rest of 99% population, wheat is not a problem. Only thing you can have now multigrain, like you can have jowari, bajri, nachani, ragi, all these kind of things. There are now a lot of knowledge available. So you can reduce wheat, but don't stop completely wheat. Gluten has got loads of medical benefits. And that is another topic of discussion, that medical benefits of gluten that has been published by the medical sites, that is Harvard Medical School, then also your WebMD, and even if you see Mayo Clinic, there are a lot of, even medicalnews.com. They say that 99% population which are not gluten intolerant, they are not at all, because gluten deficiency, even gluten, less content of gluten, that produces more risk to your heart and cardiovascular function and brain. So remember that the foods which are suitable to you and not suitable to you, that you need to understand. For lactose intolerance, similarly, the milk, those who are lactose intolerant, they are supposed to restrict your intake of milk. But those who are perfectly fine, even cancer, for example, curcumin is well absorbed in milk. So when you take curcumin with milk, it has got much beneficial effect. People drink curcumin with water or take curcumin tablets and capsules. That is not the way. You have to boil your turmeric extract in milk, and then you have to consume that. That improves your, because the milk fat, because curcumin is fat soluble. So milk fat makes maximum bioabsorption of your curcumin and medicinal constituents. Corn silk is another example, which is the silk, that is a hairy substance which is there on the shell of the corn, which is beneficial for CKD patients, helps reduce your cholesterol and also the creatinine levels. Now there was one person, there are patients with CKD where creatinine level goes very high, 8, 9, and they go on dialysis. Corn silk extract and nettle tea, these are the two rejuvenators of kidneys. So this is very important nutrition as far as your kidney, gallbladder, and also the heart related issues. Rice kanji, those now the chronic fever or various types of viral infections. There are certain infections which the origin is not known. You get all the reports negative. There is no dengue, no malaria, and no other parasites found, but still the fever is not coming under control. So such type of diseases, or sometimes there is a viral infection and secondary bacterial infection, or even the fungal infection. So these type of things are very difficult to treat. So rice kanji, this leftover rice, leftover water after you cook the rice, it tonifies the blood, improves your digestion, and it provides you a lot of medicinal benefits and nutrients. Basically, inositol, B group of vitamins, and more importantly, those women facing uterine fibroids, painful uterine fibroids, this is vardhan for them, rice kanji. You can put chopped vegetables, you can put coriander leaves, ginger, pepper, jeera, all those things, and make it a soup. That is why I normally call it as a rice kanji soup. So the best soup material is your rice kanji, and that can be consumed whenever you have got infections or inflammatory conditions, or your appetite is down, and your body gets instant energy with such type. It's also antipyretic. That means it has been reported that those who are running high fever, the fever comes under control when you consume hot rice kanji as a soup with other vegetables and spices and herbs. Wheat germ extract, as I said, it is now the treatment for various types of even cardiovascular disease, psoriasis, eczema, and even cancers. Boswellia shellacei, anti-inflammatory, and not only that, it enhances your breathing capacity. Those who are having lungs fibrosis or even COPD, and also brain hypoxemia, Boswellia shalaki, and also combination with Google, that is Mahayogaraj Google and Yogaraj Google, has got a lot of beneficial effects in such type of patients, other than patients suffering from osteoporosis, osteoarthritis, rheumatoid arthritis, etc. So,
Professor Khanuja wants to say something. Okay, it's okay. You can continue, I guess.
so there are only 2 slides now. Now,
Yes,
this
sir,
is
yes, sir, please.
possibly the last slide.
Okay, thank you, sir. You may continue.
Yeah. So there are a few points which I have noted here. So these are the myths you see everywhere that need scientific dissection. Wheat is bad for everyone. That is what people now advises. So avoid wheat. Rice is not suitable for diabetics. Corn is unhealthy. Milk should be totally avoided. Diabetics need to stop carbohydrates completely and go for protein-rich diet. Millets not suitable for hypothyroidism, and many more. So this particular slide, there are explanations and scientific explanations given. Like I said, wheat, wholesome wheat is not bad. Wholesome wheat is, in fact, is the blessing. Those who are having gluten intolerance or celiac diseases, they need to only restrict wheat, or they need to eliminate wheat from their diet. Otherwise, there is no problem. Rice is not suitable for diabetes. What I say, instead of not taking rice completely, you take little rice and more of your dal and curries and vegetables. So little rice with more of sambar, that satisfies you as far as your appetite is concerned, and also your carbohydrate intake is concerned. So you reduce your carbohydrate content instead of completely stopping it or completely not taking it. Corn is unhealthy is totally wrong, because most of the people, they are now started writing against corn. And what I say, our Indian agriculture, wheat, rice, cane sugar, corn, these are the main our crops basically. And these crops, they are blessed with a lot of, that is why in maybe 4 to 5 decades back, we were not having all these type of diseases or disorders what currently we are seeing. There was not a mention of hypothyroidism when cancers were very limited. Cancers were subjected to the curse for the family. किसी एक को कैंसर हो गया, उसको शाप लग गया है, इसके लिए कैंसर हुआ है. But now cancer, every family is having cancer. When we follow all these experts' guidelines like ban wheat, ban rice, ban milk, then why such epidemics are growing? Why our immunities are compromised at such a level? So we need to revisit our traditional culture. We need to revisit maybe 4 to 5 decades, not longer, 4 to 5 decades back, what food or diet we were consuming. We are eating on banana leaf. Now we are eating in aluminum plates or paper plates or God knows, and standing and eating and all those things. And buffet, where is all sorts of junk is there. People need to understand their lifestyle and these particular diseases or disorders which we have to withstand. Millets not suitable for hypothyroidism. This is also very wrong statement, that even doctors recommend millets. Don't eat millets. So millets are rich with so much of nutrients, like I said, magnesium or amino acids like lysine, proline. So these type of things are very, very nutritious. Only the moderation is the key. One has to understand the right quantity and the quality. These two are very important. And I'm thankful to all these world regulatory bodies. And from there, I keep on learning. Like CSIR, CMAP also I have mentioned. ICMR is one of them. Then Cancer Research Institutes, they give a lot of updates. And even there are few updates that most of us are not aware. Getting periods at the age lesser than 12 is a risk for breast cancer. So this is the highlight given by ICMR. Salute to that. So that these gynecologists or even oncologists can work towards such type of guidelines. These guidelines should be made aware. This must be made public to the people. What are the risk factors? What are the risks of smoking and alcohol and all those kind of things? So this is what is these particular bodies are. The World Health Organization. Then you have skin cancer, various type of American Diabetic, American Heart Association. So this is in short one screen, which is the acknowledgement that we must all thankful to all these bodies for regularly providing information. But this information need to be public friendly, and how best we can reach to the people with the right guidance. And I think that would be the mission for Flora Fauna Science Foundation. And I'm ready to take this mission. And this mission, I do it selfless. This is a selfless mission. There's no monetary benefit. In fact, some people say, what are your earnings? I say, I'm a bekar. I don't have any earning. So, but my earning is basically the well wishes, and patients get really recovered, and they get right tips with the scientific authentic knowledge and the knowledge from ancient Veda. See, there is no statement of mine. Every post of mine, I sign below it, because the signature saying that I am the responsible for this post. So the nutrition knowledge, what is being brought to the people is the responsible nutrition. Is not only the medical nutrition or not Ayurveda, but it's a responsible nutrition, and that is the particular effort which I am taking as a reference from these bodies or Ayurveda or Veda as such. So I'm really thanking you all, and especially for Flora Fauna Science Foundation, to giving me such an opportunity to present this wonderful topic. God bless you all. Thank you very much, sir.
Thank you so much, sir. Thank you so much. Your talk really brought clarity on the topic and cleared so many myths too. So we have received 3 questions today, 1 in Facebook and 2 on email. Dr. Sarika says, thank you for the information, sir. I want to know more about barley water and rice kanji. Can you please tell in details about the preparation and use?
Rice kanji is a simple. Nowadays we are cooking in pressure cooker. So pressure cooker, there is a very little chance that there is no chance that you will get that kanji. That is, kanji is the water when rice is completely cooked. So in short, the rice is a rich source of starch, basically. That kanji, that is the water, which is a rich source of nutrients. So that is normally we throw. Otherwise also we throw that water. So without throwing, you take that water, you cook it in an open pan. Instead of cooking in a pressure cooker, you just cook your rice with little extra water, so that you get some water. And in that you add, as per choice, salt, pepper, jeera, even you can put ajwain. Those who are having digestive issues or having reflux kind of thing, they can add ajwain also. You can squeeze a lemon also inside and make a wonder, and put a small pieces of vegetables to make it a mixed vegetable kind of drink or soup. This is real rejuvenator, because if you see, it is antipyretic, anti-inflammatory, and lot of antioxidant values. And also it is safe for diabetes, because you are not eating rice. You are having rice kanji. So that kanji with the vegetables and spices can be the ideal nutrient. Every day in our house at 6 o'clock, we consume rice kanji. So that is the secret of the nutrition. You don't have to really spend a lot of money on nutrition supplements and nutraceuticals and all that. Some simple remedies that make your kitchen as clinic. That is what is the basic this thing. And what was the second? Barley water.
Barley water.
Barley has got a lot of nutrients that you can, if you want, I can share the entire presentation on your in your mail, so that whosoever that those particular slides, that will be better. That is authentic.
Sure.
So entire mail presentation I will mail it.
Thank you, sir. I'll send the particular.
And the barley presentation you can send, because barley is now used by the CKD patients also. Those who are having kidney stones. And kidney stones are very torturous, very painful. And another one is the gallbladder stones. Now, gallbladder stones, as I said, people remove the gallbladder itself. So certain things, if you prevention is the better than cure. So when you start feeling that there is stone formation, and when your sonography report says that stone size is that, and people can refer their reports also to us, so that we can guide in a better way what is the size of kidney stones and how much lemon barley water need to be taken. Now there is a barley dosa also, barley idli also. There are a lot of other innovative recipes which I have mentioned, but I could not describe it because our time limit is.
Yeah. So please share your slides so that we can share it with others.
Sure.
Now the second question is, you told us about fenugreek, and I see that some people soak fenugreek and drink the water in the morning. Is it the right practice? I'm asking because I've never seen my grandparents and elderlies do it. Another example is blueberries. They are so expensive and come from far, and still nutritionists recommend it. Why? That's a very interesting question. Yeah.
See, as far as berries are concerned, I consider Avla is the super berry. Okay, Avla has got maximum Orac value. So in season, you can definitely consume avla, or when season is not there, you can preserve avla also at home. Keep in a deep freezer. We preserve avla for rest of the year. We buy 5 to 10 kilos avla, keep it in the freezer. So avla can be the best berry instead of other type of berries. For a fancy, you can eat all those berries which are available, but not on a regular basis. Cranberry has got specific reference now out of all the berries, which I have also shared in my slide. Cranberry, especially those who are having urinary incontinence or bladder infections or urinary tract infections, for them cranberry becomes the important criteria. Then
what about falsa?
Yeah, that is excellent.
And we can make a lot of water, falsa water, and even freeze it and keep it. It's better than any berry that you talk
Any
about.
berries. Yeah. These are all foreign concepts like bilberry, blueberry.
So that's why he specifically asked blueberry. Why blueberry? Because it's very expensive.
They are very expensive
and special mention of the fenugreek water. Is it a right practice?
Normally, see, what we do is fenugreek sprouts, which are very good. Like you make usad. Now, fenugreek sprouts, they are rich in fiber, protein, and everything. So normally we make usad. You can use as a salad also, but it is extremely bitter. Otherwise, you can make a usad along with the sprouted moongs and all that. You can fortify with it so that bitterness can be managed. I normally don't recommend eating soaked fenugreek seeds. I don't recommend, because that induces a lot of acidity. And another hyperacidity and acid reflux that goes high, and that impacts your digestion, absorption, everything. So especially diabetics, normally diabetics only consume fenugreek seeds, thinking that their blood sugar will come low.
Yeah.
But instead of that, they should eat sprouts. And sprouts and the 20 to 25% reduce your carbohydrate. Don't completely reduce it. Reduce carbohydrate, substitute with proteins like legumes, pulses, and all those things, and also vegetables. This is the thing.
In fact, instead of fenugreek, if you use alfalfa sprouts, you won't get bitterness also. It's the same family.
Right.
Okay. Yeah. So it is Melilotus album, and that is Trigonella.
Yeah.
They both have similar, but of course, fenugreek, other parts and everything have more advantages.
Right.
But what you're talking about, water, Manika, it's not actually for water, the soaking. It is for the gummy thing that comes out, and that is a prebiotic.
Yeah.
Okay. So when you want to use that gum, oligosaccharides, for preventing sugar and fat absorption, then it is useful. Otherwise, drinking water in the morning is not going to work.
So a general practice is that you soak fenugreek in the night and then they drink water in the morning. Maybe
In
he's
fact,
asking about it.
there is a question which I thought of asking Dr. Sharad, is that, after listening to your thali, and then going out of thali into fields, and then knowing so many things about our indigenous plants, what starts happening is that the quacks, they start recommending. For example, they will say ashwagandha, right? Will not tell ashwagandha root or stem or leaf or anything. They will say take ashwagandha in the morning, powder of that, or things like that. So what would you like to tell people that, what not to do? Means for nutrition particularly.
Yes, actually, the self-medication is dangerous. And the kind of information which is being given is incomplete. Now, for example, when you say any particular shatavari, is normally the root extract is more beneficial. When you say shatavari, ashwagandha also root, but there are now fruits and leaves. Also, they are beneficial. But depending on the type of condition. And another thing is they don't mention the concentration of actives. And some people they say it is 2% extract. So what is that 98% that they are putting? So these things are gray areas. Like I mentioned, heavy poisonous metals. Now, when you walk in medical circle or medical professionals, they will always ask the toxicity or safety or other type of data. They say that these type of herbs, they are renal toxic or toxic to certain type of patients or heavy metal poisoning and all that, which data is not available on the labeling and packs. That is another aspect. Then thing is like guduchi or we say amruta, the leaves. But there are medicinal properties with stem, guduchi stem, as well as fruits. So no one talks about all that. They just say giloy or guduchi, whether it is stem or whether it is fruit or whether it is a leaf. So these type of specialities, normally, see, we make ghanvati. Ghanvati is with the cow ghee. We make small tablets. This is ghanvati in a small Ayurvedic fashion. So that ghanvati, we use cow ghrutam for better absorption. Instead of using any other pharmaceutical excipient as a binder or disintegrating agent or that way, we use cow ghrutam. And we use extracts from leaves as well as stem. Leaves and stem, these are really important. And the concentration of those two are also important factors. So if you see my posts, they always mention the bifurcation. That normally I call it the dissection. That is a complete information of a fruit or vegetable or herb or spice that need to be given. Otherwise, there are supplements. Same ashwagandha available 60 rupees. One other ashwagandha is available at 600 rupees, and one ashwagandha is 2,600 rupees. All are labeled as ashwagandha only. So how the consumer will know? So consumer will come to the conclusion that the expensive one is pure, but that may not be the true factor. So you need to justify, like a regulatory, what I feel, that regulatory should come into Ayurveda medicine. That is very important factor. So impurities and purities. In drugs, it is more of the side effects they give first. No, you see any drug in drug index, they will list the hundreds of side effects. This will be nausea, vomiting, you will get seizures, even death. Death is the side effect given. In spite of that, these drugs get approved and practiced by the doctors because they know the pros and cons. Here in Ayurveda medicine, they don't know pros and cons. If I take in excess, and the dosages are not known to anybody, this is the concentration, this is the dosage recommendation, and this is a particular medical condition. So this particular documentation is important, and which is even given in our Ashtanga Hrudayam. If you see Bhav Prakash Nigant or various scientific or Sanskrit Atharva Veda, they have given all this documentation. But we need to bring it to the practice, because this is all based agriculture only. See, you are growing boswellia, you are growing guduchi, you are growing ashwagandha, shatavari, tulsi, ginger. All these are related to, but these are the medicinal plants, of course, in a more scientific manner. And regulatory should come into, and regulatory should be with the power. That power given to the regulatory bodies, that is more important.
Yeah, that's where how much is too much.
How much is
becomes
too much,
important.
Yeah. Yes.
And also a very horrifying thing that happened this week. So many children died in Gambia, Africa, because of a cough syrup where DEG content, ethylene glycol content was just unregulated, and that's a pharmaceutical composition. But when it comes to food, people have to understand the difference between functional food and medical food. Yes. Medical food is not a daily diet, but functional food can be a daily diet thing. So, people have to also understand how to read label, because although we have FSSAI in place, but then how the labels are made and how labels have to be read. Yeah. So, I think it's a very long-going topic where you would have to intervene many times later also with us. We'll like to take this as a campaign in one of our programs, which you also would like to have your passion going in, is Nutri Pathshala. Where, if we can do the right seeding, then we can expect a crop. And that seeding has to be done among children. If children are aware, they will insist with their parents, no, my teachers have told this, you have to do like this, otherwise talk to my teacher, right? So, in fact, children get so influenced by their rickshawala or bus driver that if they say anything, they say, no, rickshawala bhaiya told this, and how can you say this? You ask him. So children, if they are influenced positively with a knowledge that can take them to a better life all through, and then they taking care of their grandparents. That in our school we learned this. It can really make a big difference. So I think you have really given us a complete journey to reach the thali from outside the thali, and also provided the desserts and beverages along with it, and then medical foods, which condition specific way we could be going. The last thing that I would like you to spell out to people is, how cooking becomes important, because thali is made up of uncooked and cooked things.
Yeah.
So, there are precautions in cooking also,
Yes.
right? Which, although we may be saying this has so much of advantage in terms of vitamins or amino acids and things like that, but then your wrong cooking may really spoil the whole thali. So if you would like to give a thumb rule for cooking to people, we'll close with that.
Basically, earlier the concept was eating raw, but now the cooking concept has introduced. Maybe pandemic, we have seen the fruits and vegetables, everything need to be washed, pasteurized, that kind of thing. The main worrying factor is the pesticides and insecticides that are coming with your stuff, that is fruits and vegetables. So basically, getting rid of those, and also the cooking. Cooking becomes, or steaming of vegetables, and instead of eating raw, you steam the vegetables and add some spices for garnishing, and then you can consume without any oil or much of salt and other things. So that is normally I advise. Utensils, there is now a lot of debate on which utensils are safe to use. Now some people use iron vessels. Now there I have seen those hemoglobin levels increased dangerously high. So instead of your hemoglobin level is, let us say, 15 or 16, that is a maximum, their hemoglobin levels went up to 28.
Huh.
And their doctors recommended all the cancer antigen tests. The simple thing, while interviewing, I asked, what is the method of cooking? He said, we use iron vessels. Then I told him to stop iron vessels. So again, moderation is the key. It is not that you blindly follow somebody. So stainless steel vessels, or somebody are the coated vessels and all those things. So use the safe mode. Microwave is dangerous. So I say no to microwave cooking. The radiation, which can do the worst in such type of the areas where the what you can say medical this thing is very expensive. Because when you approach to any particular medical help, the cost is tremendous. So medical cost is tremendous. So microwave cooking or microwave radiation to be avoided. Use iron vessels only in moderation. Don't use for everything. Like some foods are, most of our curries and gravies are acidic. You use a lot of tamarind, you use a lot of souring agents and all that. So cooking in iron vessel, iron may leach, and then that dangerously high iron level can damage your health. So better safe is your stainless steel. That is what normally I recommend. And also instead of eating raw salads, you eat the steamed ones. That is always a better option. And 5 fruits and 5 vegetables. That is what normally I recommend to the people. So you get variety is the essence of life. So any 5 vegetables which are carotenoids or iron, folic acid rich vegetables and fruits that should be eaten in the breakfast. Curd is important. That is another, because this is the best probiotic. 1 cup of curd gives you almost 50 billion probiotic spores. So Lactobacillus acidophilus, which is the best form of your gut-friendly and also balances intestinal microflora. So I think curd is best. Buttermilk is, you can say, balle. Whatever buttermilk I like, I normally carry along with the bottle of water. I always carry buttermilk, which is spiced buttermilk. So whenever I'm thirsty, so my attention doesn't go to the soft drinks or other cold drinks which are there. Always I take a sip of buttermilk with some spices like jeera and all that, simple spices. So basic things. And coconut water I take once in a week kind of thing. Coconut water is also excellent detoxifier. So that I take. That is why one slide shows lemon juice, coconut water, and buttermilk. These are the three super drinks and beverages of our traditional culture. Or you can add kokum juice also in that. So these are the super beverages or drinks which we have now replaced with a lot of soft drinks and other things. So considering, I think revisiting or re-auditing our back days, our forefathers, how they lived healthy. They were not having any major ailments. Like now, 20 years of age, your age, metabolic age is 70 years. He is having arthritis, baldness, he's having vision loss, all those things. He is following all the things, like he's eliminating meat, he's eliminating milk, all the things he's doing. In spite of that, and taking a lot of medicines. In spite of that, instead of now your physical age or natural age, metabolic age is more important. So how older are you, and what is your metabolic age? That is need to be now, all of your Aadhaar card and everywhere it should be mentioned your metabolic age. The patient may be of 30 years, but his metabolic age is 80 years. So he's not fit. He's not fit to work. He's not fit to function. So this all is now need to be revisited. That is why I said KYC. Know your cardio, know your everything, kidneys, or know your functions of organs.
Yeah.
Thank
Okay.
you so much, sir. It was an intensive discussion. Thank you. We can have another session, with, only a discussion session with sir, and we can go live sometime. What say, sir? Only some few discussions or questions we receive. Okay, we can plan it in future. Thank you so much, sir. Now, I request Dr. A.K. Singh to please present the vote of thanks.
Thank you. So, as you all agree, health is a #1 priority of everyone today. हम लोगों की सभी का ध्यान हेल्थ की तरफ जाता है, और इस परिप्रेक्ष्य में आज का जो डॉक्टर शरद कसारले जी का लेक्चर जो लीड टॉक थी, और जिसका आयोजन फ्लोरा फोना साइंस फाउंडेशन के बैनर के अंडर कृषि से खुशी थीम के अंतर्गत ऑर्गेनाइज किया गया, बहुत महत्वपूर्ण है। डॉक्टर कसारले ने न केवल ये बताया कि कौन कौन से प्लांट बेस्ड न्यूट्रिशन हमारे स्वास्थ्य के लिए जरूरी है, बल्कि कब और कैसे किन वस्तुओं को, किन पदार्थों को खाना चाहिए डिफरेंट मेडिकल कंडीशंस के लिए उन्होंने सलाह दी। और बेहतर होगा कि हम मेडिकल न्यूट्रिशन एक्सपर्ट से या डॉक्टर कसारले से या दूसरे जो एक्सपर्ट्स हैं उनसे जरूर सलाह लें जब मेडिकल कंडीशन की बात आती है, और जब किसी मेडिसिनल प्लांट का आप सेवन करें तो वैद्य की या जो एक्सपर्ट्स की जरूर सलाह ले लें। धन्यवाद डॉक्टर कसारले, आपने गागर में सागर भर दिया, और जो न्यूट्रिशन से संबंधी जो लोगों के बहुत सी भ्रांतियां भी हैं, कब कब क्या खाना चाहिए, क्या नहीं खाना चाहिए, जैसे मिलेट्स के बारे में जो गलत धारणा है, और डॉक्टर सलाह देते हैं कि इन्हें ना खाएं या इसे खाएं। बहुत चीजों पे आपने प्रकाश डाला, लेकिन और भी इन पर खोज और इनका स्पष्टीकरण होना आवश्यक है। एक बार फिर हम आपको धन्यवाद देते हैं इस मंच की ओर से, बहुत बहुत धन्यवाद। और हमारे जो फाउंडेशन चेयरमैन है फाउंडेशन के डॉक्टर खनूजा, तरह के आयोजन शुरू से होते आ रहे हैं। जैसा कि उन्होंने शुरू में बताया कि डिफरेंट थीम्स के अंतर्गत ये मुहिम है फ्लोरा फोना साइंस फाउंडेशन की, कि इस वेब सीरीज के अंतर्गत हम डिफरेंट एक्सपर्ट्स को, डिफरेंट फील्ड्स के एक्सपर्ट्स को इस मंच पर लाते हैं, ताकि हमारे किसान, हमारे उद्यमी, आम जनता, विद्यार्थी, रिसर्चर्स और यहाँ तक के जो वृद्ध, युवा, सभी प्रकार के समाज के लोग इससे लाभ उठा सकें। मैं उन्हें धन्यवाद देता हूँ। और इस प्रोग्राम के संचालन में जो हमें सहयोग मिला, डॉक्टर मनिका, डॉक्टर नीरज को काफी हम आभार व्यक्त करते हैं। उनका सपोर्ट इस प्रोग्राम के आयोजन में सदैव मिलता रहा है। और तमाम लोग जो आज फेसबुक लाइव से जुड़े, उन्होंने इस प्रोग्राम को सजीव देखा, और तमाम लोग यूट्यूब में भी देखेंगे, क्योंकि इसकी रिकॉर्डिंग उपलब्ध रहेगी। और निश्चित रूप से डॉक्टर कसारले का लेक्चर बार बार देखना चाहेंगे हम लोग भी, कभी रेफरेंस की जरूरत होगी, क्योंकि बहुत ही सचित्र और उदाहरण के साथ आपका लेक्चर था, बहुत ही इंफॉर्मेटिव लेक्चर था। मैं सभी को धन्यवाद देता हूँ। और साथियों, अगले माह दूसरे शनिवार को हम एक नए एक्सपर्ट और एक नए विषय के साथ हम पुनः आपके सामने उपस्थित होंगे। तब तक के लिए धन्यवाद, नमस्कार।